Welcome to the Capstone Conversation, where you learn about what's happening in the greater East Bay. I am your host, Jared Ash. Today we are continuing our look at mental health here in the East Bay. Xiaofeng Chen from the Allen Yu Foundation and Steve Nemo with the Z Cares Foundation. Active here in the East Bay, helping people in our community in need of mental health support. This is an immediate follow-up to one where we had Dr. Karen Tribble from the Alameda Behavioral Health and Jesse Champlin from John Muir Health talking about mental health too. I'd encourage everybody to go back and listen to that episode and learn more about this important topic and how it's impacting us in the East Bay. Which one of the two of you would like to go first? If you can introduce yourselves and tell us a little bit more about your foundation and what's going on.
Okay. I'm Xiaofeng Chen. I'm Alan's mom, co-founder and president of Alan Hu Foundation. My son, Alan, he was 15 when he passed away. He fought so hard with mental illness, specifically depression, and he reached out for all the resources he could get at his young age, and every one of us helped him. We thought he was getting better when the illness flared up and he just passed away by suicide. That was devastating to all of us and all of the people who care about him. My husband and I founded Alan Hu Foundation with the hope that to prevent such tragedy from happening to any other families. Our mission is to promote mental health, raise awareness, and remove stigma surrounding psychiatric disorders, and support fundamental research for cures. I'll pass this along to Steve.
My name is Steve Nemo. I am the president and co-founder of Z Cares Foundation. We couldn't describe Z Cares Foundation without describing the Z in Z Cares. Z Cares is for Zachary. Zachary was our son. Zachary passed one day short of turning 15. He was struggling heavily with anxiety and depression. We had him be with a psychiatrist. He was talking about it. We had open conversations. But unfortunately, he lost his battle with mental health. When that happened to our family, my wife, Maddie, and my daughter, Samantha, and I, we had a decision to make. It was either curl up in a ball and almost drop out of society, or we could continue Zachary's message. Zachary was an interesting young man. He was an athlete. He played on a competitive lacrosse team. He played soccer. When he was younger, he played basketball. He was really into sports. He was into athletics. But he also considered himself a self-described geek. He loved comic books and he loved fishing and a lot of the things that some kids may find out of the realm of an athlete. And through that, he became friends with nearly everyone. The day he passed, a friend of his was being bullied at school, and Zachary stood up and made it stop, helped his friend. That moment became the emphasis of the Z Cares Foundation, where we now stand up against mental health. Our ambition is really to open up conversations around mental health and to help people understand they're not alone and it's okay to have these conversations. We're trying to drive that forward in Zachary's memory and continuing his vision, standing up to help others.
Yeah, and as the listeners know, I have 3 daughters, 10 and under, and I am not going to even understand what they could possibly go through. They are all, at least right now, seem to be in good mental capacity. I think why is this episode important to me is the topic has come up. There's so much happening locally and so many people and kids in particular, but everybody that needs help. And that was one of the messages of the other episode I referred to earlier on mental health was speak up, remove the stigma. Let's help people. You both talked about educating people, making them more aware. How do you go about that? Where do you get resources how do you become an expert in that? How do you share your info?
kick that off. And I think our organization's with a very common mission, and we've approached it differently, which is fantastic because that allows people to be educated in different ways. When we first started down our mission, we actually had, right before Zachary had passed, we saw a film called Angst. And it's a film about anxiety. Educate people what anxiety is, what it looks like, what it feels like, how to cope with it, those types of things. This was part of our mission of trying to support Zachary with what he was going through. When he passed, we got in touch with the producers of the film because it spoke to us from a standpoint of what Zachary was going through, and we wanted others to see it. The producers of the film supported us in going out and providing some screenings and just bringing the community together to start conversations about mental health, which we found fantastic. But we kept finding we kept getting a question of, that's great, we get to see these kids, but what about where are they today? My wife, daughter, and I were out on a walk, actually during the COVID years, trying to get outdoors and cope with everything that was going on. And we got to talking about that question of how to share the story, how to share the whole story. We always debate who said it first. The statement was, why can't we share all the stories of the amazing youth we've got to talk to through our journey and the people who have come forward? And then we said, yeah, we can share their stories of hope. We, at that moment, in that walk around the park, we actually became filmmakers. We started to produce our own films, got in touch through our friends that were producers of Angst, helped us get started. We started to produce films, to strongly believe in the power of film and the ability to share stories. We found some amazing youth to step forward and share their stories. We produced a full feature documentary featuring 4 young youth sharing their stories from all of their struggles, what it felt like, all the way through how they found hope and how they found a path through their struggles. And we've shared that film multiple times, great feedback. We won awards. All of that is fine. But then we were approached by Cal Hope here in California, we would like something like that, but we need to be able to condense it into a classroom. We started to produce short films. We've since produced 9 short films featuring, each of them feature a single individual through their journey, sharing what it took, what it felt, and how they found their path to hope. And that's become a cornerstone to the ZCares Foundation. We now feature the films into our education programs that allow people to understand what it feels like. Again, open up conversations. We'll sit with an audience, we'll watch a film, and we'll sit and talk about it. The feedback that we've gotten has been extraordinary. And the one I'll share, the one that touches us the most, we have a parent come up to us after watching one of our films, and all their statement was, "You just saved our daughter's life." And that's what it's all about. It's one person impacted by anything we do, and that keeps us going. That's how we approach opening up, trying to help the community understand they're not alone and there is a pathway to hope no matter what they may be feeling today.
Wow.
ZCare has done a great job. We greatly admire what you have done. And I think it was a wonderful way to get the message out and then start conversation. And in Alan Hu Foundation, we take a different approach. As Steve said, their work heavily impacted by Zachary and our work heavily impacted by Alan. Because Alan was a very intelligent kid. He liked to read and he read a lot. Got all kind of different information from reading. And he also when he was in middle school, he actually enjoyed a program called Breakfast with Asper, which was organized by his favorite teacher, Lin Gatehouse. He went there and he always got great information to share with us. And he wanted to become a psychiatrist to heal other people. After he passed away, my husband and I started to think, and our board, the whole board started to think what will be a good way to get the message out, to get mental health knowledge to other people. Because my husband and I, Qixing and I, felt that we were both well educated in some way, but very ignorant in mental health knowledge. We thought about what happened to it because it was not taught at school. It was not taught at home. It was not taught at community. So there is a need to learn about what is mental health, what are the treatments out there, what's mental illness, and if you need help, what you can do. That brought up to a thought that we can have a lecture series. We will bring experts from mental health fields, such as universities, hospitals, and to bring them to give talks about specific topic about mental health. We started our mental health lecture series in 2019. And it was an in-person lecture. Actually, Steve and Manny were there too. A lot of people got together and listened to Dr. Singh from Stanford University to talk about mood disorder. And that was a great event. We got great feedback about it. We did another one with Dr. Joshi, is also in-person lecture. However, COVID kicked in. So we couldn't do in-person lecture anymore. It also brought an opportunity to us. We can do webinars. That's what we have been doing ever since then. And it actually opened up a door for us to invite specialists and experts from around the country to join us in the webinar to talk about mental health. And we cover different areas such as depression, anxiety, and that's what mental illness. We also cover how to prevent and like positive psychology, that's mental hygiene. And we'll talk about treatments like CBT and interpersonal relationship therapy. We cover a lot of different topics, and our audience greatly enjoy those webinars and they learn a lot from the lectures. We're going from a different route from Z Cares, but we have the same goal that will disseminate mental health knowledge to the community and encourage people to seek professional help when in need.
Your son Alan was pre-COVID when this happened?
He passed away in 2018.
And how about Zachary? When did he pass?
Alan passed away in January and Zachary passed away in October, unfortunately.
And today in the schools, what are they in high school, middle school? Are they addressing this? Do they raise awareness?
We both in Pleasanton Middle School, Pleasanton Unified School District. I know that the school district has been doing a lot more compared to when Alan and Zachary passed away. Now, at least the current situation is I know they have mental health awareness week from each school, and during that week, they will talk about mental health and have different activities and even bringing organizations like us on campus to share information about mental health. And I know they also have suicide prevention workshop, but I feel that more can be done about this because it's not one week, it's not one workshop. It should be daily. Mental health should be a constant conversation. That's what we're lacking. We lack the conversation in the community to talk about how are you feeling? What's your stress level? How do you sleep during the night? Those two very good indicators of your mental health. But usually, especially in PUSD, kids are so competitive. A lot of conversation like circling around how you do academically, which is good. We need that. But on the other hand, I think mental health conversation and awareness and knowledge is more critical compared to academic performance.
I'm going to check my email to see too if he's trying to get back on and sending me a note.
Let's just keep going and I can add Steve back. So is that happening today in just the Pleasanton Unified, or is that happening throughout all of the East Bay schools? Is that happening throughout California?
A lot of schools are doing a lot more right now. I'm aware that like Dublin High School and Dublin School District and Livermore School District, they're doing a lot to promote mental health. And there are students that are especially active in mental health activities. We got invited to Dublin high schools to attend student-organized mental health events. And we also, Allen Hu Foundation also has a scholarship who encourage kids from Tri-Valley's high schools to go to mental health related fields to study. we receive a lot of applications, and the students, they did a lot at school. I'm hopeful that this will be a trend that more and more schools are doing. More and more schools are promoting mental health, and more students will join those activities. Steve, we're glad you're back.
Yeah.
A little concerned.
I think the bad time to drop.
Yeah, I notice at 3:00 most days my bandwidth goes because all my neighbors' kids are probably home watching TV or video gaming. So Steve, we were just talking about what's happening in schools. How do they start bringing this in? If a school's not doing something, where do they begin? How do they start including something like this or partnering with organizations like yours to make people aware?
Yeah, it's a tough one. And I think a lot of it begins with the kids. And I have to say, anybody who makes statements like, I fear for our future because of today's youth, has never talked to today's youth. Our youth is inspiring and deep and caring, and they really want to do the right thing. And so anyone who doesn't recognize that isn't spending the time having the conversations. One thing that we've done because of that is we actually have what we call a youth ambassador program made up of all high school and college kids who share their own voice and they go out and actually develop and run their own programs within their schools with our support. And they'll do everything they can to continue our mission into the schools. These kids are amazing. Going back to the film we made, one of the films we did featured a wellness center in Livermore. We spent a lot of time talking to the kids who utilize the wellness center and why they go and what they do. It really, in this case, takes the school's commitment to really lean in on what's important. It's the whole child, not just the sure their wellness is in check and those types of things. And schools like Livermore, in this case, really do lean in on that. And again, some of the kids opened up and their parents opening up on why spending time in a wellness center isn't something like skipping class. It's about having a moment to check in on yourself. We got to see this combination of the administration and the student body coming together to build this program. It was actually originally built by the kids at the school. They were given a project to what might this look like, and they built it in their own vision. And I think it's that combination of the administration believing that they can and the kids being who they are, really inspiring and wanting to help one another, that's helping bring it together in the schools. But at the end of the day, we can't kid ourselves either. The funding is a problem, and what the schools are able to do is certainly a problem. But if we just give the kids the space to lean into their mental health and what they need to help themselves, I think we'll find ourselves in a good place.
Yeah, and I want to pick up on what you said about the people who say, oh, this next generation. I was just interviewing a young 26-year-old vice mayor from the peninsula on here, and Rob Moore, and he was saying, like, people just don't necessarily understand it. We don't want to live in, this generation doesn't want to live in single family homes. The average home here is $3 million. I'd love to, but I came out with student debt at a higher ratio than the last generation. They call us lazy. I'm involved in everything else, and I know people who are active. And so I think part of the mental health message that I would take from that is give some of this next generation the chance, because I bet you our great grandparents said the same thing about our parents. And it's as things changing, the world's changing, and that's important. What message do you want to give to parents out there? What should they be looking for? How do they engage their own children, their neighbors' children, the other people they're taking to carpool to a soccer game or something? What sort of is your message? What do you want them to be aware of? How do they engage in this conversation?
Yeah, that's a big question. And I'll lean back on one of the experts in our films who we actually asked that very question. And I loved his answer. Just be there. Let your kids know that you're there. Be vulnerable with them. Let them know it's okay to have your emotions. Let them know it's okay to go through what they're going through. And it sounds so simple to just be there, but it's actually easy too. Letting them know that they have a space to talk about what they want to talk about. Letting them know if they don't want to talk to you as a parent, that they should be talking to someone about what they're going through. And it's a strong message I lean back on a lot when parents ask that very question of just let your kids know you're there. Even though it may not feel like they're listening, they really are. If they know that you're there for them, it will mean something.
I love the message, and I think it really works. And to elaborate on that, I think parents can be open-minded and curious about what's going on in kids' life, the whole life, not just academic and not just successes, the whole thing. Just be curious and open to any emotions. So kids can feel safe to share vulnerable moments. They don't have to be successful all the time. They don't even have to do that. They can be themselves and just be with parents. And if they can feel that safe space to share whatever is going on in their life, that will be a base for them when they actually meet something that really needs adults' help. They will reach out because they feel comfortable to share, to build trusting relationship, and to have kids feel comfortable to share whatever in their life. I think that will be a fundamental way to help kids to go through what they are going through.
You both talked about this stigma of mental health and how that's a problem. How do we bring this more into the mainstream and make it so it's okay to ask for help?
I haven't thought about that.
Please.
In Alan was not having any stigma at all. He actually reached out to us before we noticed any symptoms. And he just reached out and said, I'm not feeling well. I need help. We got him help right away from the very beginning. He first saw pediatrician, then the pediatrician said he needed psychologist. We saw psychologist, and psychologist said he needed psychiatrist. We saw psychiatrist. Everything we needed to do, we provide treatment to him. And he always reached out to his friends talking about what he was going through and asking for help. Stigma was not a problem in our home, but after Alan passed away, we started Alan Hu Foundation, and we noticed that it actually was a big problem in the community. People did not want to talk about it. People did not want to reach out for help. I have to say, it actually is getting better, especially for young people. A lot of young people, they're very open to reach out for help. Of course, some of them were reluctant to do that. But I think as the treatment progressed, as we know that this is an illness, this is nothing to be ashamed of. Depression, anxiety, it's just like any other physical illnesses. It's just what you will come across during your life. And there will be treatment for it, and there will be better understanding for it. Stigma will disappear. Right now, we're still working really hard to understand what the illness is, what the treatments are. But I believe once we get there, we know how the brain is functioning, how it is malfunctioning, and why it is causing all these illnesses. The stigma will disappear. And that's what ZCares is doing, using their excellent films to share stories about hope with the community. And I pass it along to Steve.
Now I don't have a lot of new information to share. It just, from a stigma, the stigma is just kind of, let me quote my daughter. When she was a senior in high school, she facilitated one of our sessions for us. And the kids came back, and the theme they came back was stigma is stupid. And as I built upon that, it was like, if I'm out on the sports field and I break my arm or twist my ankle, I go to the doctor, right? And I go and take care of these things. Why mental health considered the same? If I'm struggling with my emotions, struggling with anxiety, struggling with depression, struggling with whatever, insert mental condition here, why can't I just go to the doctor? And the stigma is the thing in between. And I agree wholeheartedly. And I think it's improving at the youth level. And I think we as adults need to be better at it, of accepting that our kids are struggling with something and be there, help them go to the doctor, talk about it. Back to the broken leg. We're not ashamed of that, right? We go find the cast, right? There's shame there. So why do we have shame with things in our head, right? And I think if we can embrace that, I think we can shed the stigma. I think it's giving the youth of being very open to it. I think until the entire community embraces, that barrier is going to remain.
I want to add to this.
Please.
I totally agree what Steve you're talking about. And there's a tricky point I just wanted to add. When we break an arm, break a leg, it's very easy to see. But when it's struggling mentally, sometimes it's not easy to tell that we are in trouble because it's just in a spectrum. It's such part of the daily life, and sometimes we just cannot tell we're in maybe a pathological state already and that need professional help. That's what we're doing. We're trying to bring that awareness to the community so people will pay attention to our own mental health state. Say, okay, this is not good. How bad is this? Do I need to see someone? Do I need to talk to a professional? If stigma is out of the way, when is the time? Because we don't always know. Our expert will talk about 3 things. One is duration, how long it has been like this. And the other one is intensity, how intense it is, how bad is it affecting your quality of life. And the other is frequency, how frequent is happening. Does it happen every day or every other day? Or if all 3 of them are bad enough, then it's time to seek professional help. If we can get this awareness out and everybody can be aware of that, then we'll be more willing. And we know when to reach out for help.
No, I love that. I love the check-ins. If you're asking the question, should I go see a professional? Right. You've been to the doctor and they've said, oh, twist an ankle or whatever, it'll get better, which is okay, right? But if it happened to be broken, then I would have had to take an action, right? Same thing with the mental health. If that thing in your head says, should I, just go check in.
That's a good point. And we actually were talking with other mental health advocates, and they asked the same question. It's not about, should I see a doctor? It's, should I call 988? If you're thinking about that, call 988, and that will always be helpful.
Yeah, that's a good resource to get help and get talked down. And I pulled up a stat as you were both talking there. According to the National Institute of Mental Health, they estimate 31.1% of Americans will experience full-blown anxiety disorder at some point in their lives. Nearly 3 in 10 adults, 29%, have been diagnosed with depression at some point of their lives. That assuming they were diagnosed, right? How many people were missed in that? That number is even higher, but let's use the stat as it is and say that includes everybody. 3 out of 10, that's 3 out of 3 people on the floor of 2 teams playing basketball together. That's more than 3 people on a baseball field at the same time on one side of the field having depression. And again, that's diagnosed, but I say it with those examples because it is more present than we think it is around us. And some people have it small, some people have it much worse, but it doesn't have to be the stigma out there, and you can get help. And you're right. If somebody's asking, if somebody's thinking about it, chances are that's when it's helpful. And early intervention is helpful with a lot of things. So better you go in early before it becomes late.
Nothing short of agreeing. We used to, at our films, we would have the audience stand up and we tell everybody, look right and look left. One of the 3 of you is struggling with a mental health disorder. We've had large audiences. We've screened our films in front of thousands of people at the same time. I think it resonates well when people start to see the statistics of it's really more prevalent than we might think. All we can do is help one another, recognize that and acknowledge it, and together we can do something about this.
And also think about it's such a common illness, and maybe you can think about a common cold. It's not special like when someone had illness and treated as illness, not as a shame or not as somebody's fault, not finger pointing. People get sick for whatever reason. It's not people's fault. And when people get sick, get help. Once we can get the blame and the shame out of the equation, I believe a lot of people will reach out for help. And that's what we're working hard to create such a community that everyone can feel comfortable to reach out for help and feel comfortable to share their vulnerability with other people.
Let's talk about how to get help. And there's so many different groups. There's parents and there's teachers, there's neighbors, there's community members such as a sport coach or a priest or a rabbi or whoever. If those people see something in somebody else, what do they do? I know you talked about compassion and love and just being there, but how do they get resources? How do they get the person the next level of help?
Pediatrician is always a good way to go. And if the adult in the kid's life notice something, it's always good to start a conversation. Of course, before that, we hope the adults have a good relationship with the kids so they feel comfortable to share their struggle, can broach the conversation and say, I noticed this. Are you feeling that way? And there is help here. And let's go to the pediatrician to do a checkup and see, to do an evaluation. A lot of pediatricians now, they have screen tools in their clinics, so they can do anxiety screening and they can do depression screening, assess how bad the situation is and what kind of need they need. And if they need more support, then we'll go to a therapist, a psychologist, or maybe psychiatrist.
Steve, you want to add?
Yeah, that's a great answer. When early on, my wife and I went and certified in what's called youth mental health first aid. And think of it like CPR for mental health. Like CPR has its own acronyms of ABCs, which is airway, breathing, compression. Youth mental health first aid has its as well. It gives you a path to supporting youth that are struggling. And the final two parts of it, it talks about being there for them, listening for them, and that type of thing. But the last two parts of the equation talk about exactly what your question is. How do we find help? The first is in the non-professional. I think you did a great job of outlining. It could be within your church. It could be within your sports team. It could be a teacher. It could be a police officer. It could be your parent. It could be an uncle, an aunt, whoever you can have a conversation with. And those are great resources. In one of our stories, one of our youth talked about that she finally got the courage to talk to her health teacher. And it was that conversation that gave her the courage to then go have another conversation with her mom and then another conversation with her pediatrician. Those non-professional resources are fantastic. And then it's getting into the professionals. And I think starting with a pediatrician is great because your pediatrician is accessible. There is definitely the shortage of mental health professionals out there, particularly for the youth. And I'm so thankful to see more and more kids graduating with a degree in psychology. Our own daughter graduated with a degree in psychology. The kids that have come through our Youth Ambassador program are now full-blown therapists helping youth. It's great seeing that. I want to see more and more of that. A pediatrician is a great entry point to helping. We talked about 988. That's a great resource. We've had a chance to meet with the Alameda County Crisis, tour their facility and all the great work they're doing there. And they can also help. One, if you're in crisis, they can help talk you through it, but you don't have to be in crisis to make that phone call. They can also help you navigate what the path may look like of finding help. Zachary's pediatrician was fantastic in helping us reach the next level of support. It's a path you need to find. It can be difficult, but if you stay with it and communicate with your school and communicate with your church, that's a space that you're comfortable with, and communicating with your primary care doctors, they're all willing to help, but you have to be willing to ask the question.
I want to add one resource I forgot to mention. If you're in Tri-Valley area and you're in a mental health urgent situation, you can always call Access Bridge Mental Health Urgent Care. They offer services free to Tri-Valley residents. And I believe they work from Monday to Saturday. It's a great resources for Tri-Valley residents.
And I know if there's an emergency 988, they will always answer the phone, but you could always go into an ER, the John Muir Hospital Network, the Kaiser Hospital Network, the Stanford Health, and the Sutter all have the ability and resources to help you if it's that bad of a situation. Walk in and say, I just need help. Just the same way you would with that broken leg and from a car accident. Steve, you talked about that mental health training, the CPR sort of class. Where do people go take that? How do they find out about that?
We used to train in it. It's Youth Mental Health First Aid. If you go to Mental Health First Aid USA online, courses everywhere. Most of them are free. Some people do charge for their courses, but it's out there. It's accessible. There's literally thousands of courses happening nearly every day across the country. And it's a great resource to just educate yourself. It's about awareness and what you can do. The course we took is adults helping youth, but there's also courses for youth helping youth and adults helping adults. It's all there. We found it to be an inspiring program. And every class we did, we trained several hundred folks through that. The stories are powerful and you share a lot of information. The emotions are strong because of topic, but it's powerful and people really embrace the concept.
And how do people learn?
Hitting us on our website is always a great way, thecares.org. We also have the social media, the usual Facebook, Instagram type thing out there that folks can reach out to us. And we're happy to come help. Our films are available for free. If you go to our website, it'll direct you how to get there. And it's there to help the community.
And Xiaofang, how do people learn more about you?
Same here. Get to our website, alanhufoundation.org. Facebook, we mostly post webinars and linking. Also, you will find our webinar information. All our webinars are recorded and on the YouTube channel. You can sign up to youtube.com at Alan Hu Foundation to our YouTube channel or sign up our newsletter and we'll send out emails about our webinars. If you missed them, just check out our website and our YouTube channel. And if you're Tri-Valley High School seniors and you wanted to pursue study in mental health field, you're welcome to apply to our scholarship at the end of the year. Usually we open it in December.
And I want to ask something else before we go. Both of you have had teens. Was social media an issue? Did online gaming, did any of that have a role? And that wasn't necessarily around when the parents today were 15. Was that an issue?
I think I get your question. I think social media, and I'll speak to that, and I'll speak to the gaming too. I think social media is a double-edged sword. Particularly a lot of the films we put out there, if you go and watch them, it became one of the terms, and I'm sure you know this term well, but this concept of doom scrolling, where you're just stuck in this world of scroll, and you think you're hitting yourself with something of joy, but you're caught in this loop. Just we'll call it despair, whatever it is you feel at the moment, you're caught in this darkness. And that doom scrolling certainly is not supporting it. But there's a positive side to it too, because there's a connection that can happen through social media. And if that's your tool for connection, there is some value there. Certainly you don't want to get to the point where you're sitting in a dark corner and that's your only source of connection, but it is a connection point. And one of the conversations we had with our advisor was almost the exact same question: was because our son played, he was well into his Xbox. He liked to be on there, but when he was on there with his friends. And that is a source of connection. And connection is very important for youth development. Again, there's limits to everything, right? You can't be caught staring at the screen the whole time, but there is a connection that comes out of it. I'm not a huge advocate of social media and being stuck on your phone all the time, but I do want to point out that there is something of value that can be lost in it. I don't want to point it out as the villain in the story, but it's definitely something to keep an eye on.
I would think parents should be very aware of the addictive factor of social media or any internet usage or any electronic device usage, because it is addictive. One of our webinar experts, Dr. Lemke, actually talked about this. The dopamine, and her topic is dopamine fasting. We actually in a world that everything is addictive because its potency is so high. Talking about gaming, talking about social media, talking about food, talking about books we read, everything. Parents, I would say it will be a good advice for parents to be aware of this and pay attention to what kids are doing online. Just as Steve said, if they're staying connected in a positive way, that's okay. But if they're being sucked into a black hole and just stuck there and not going anywhere, then parents can do something to guide them from a very young age to set a good habit, a good limit of how they're going to use that powerful tool, because it's really powerful. It can destroy you, and it can also enhance your intellectual relationship. But kids need guidance. Parents would be doing their kids a service if starting very young to help them to know what's good for them and what's bad for them and what is going to get them addicted in a bad way. That can help a lot, I believe.
Yeah, those are really good points. One of the kids in our stories, she shared, like, everybody's living the life I wish I had when she saw them on social media. Today, she realizes that what she was looking at was them spending hours enhancing a photo and placing themselves in a situation that made it look like they were living a life. So there's a false pretense that can come out of what you're seeing, and you get this whole FOMO world of the fear of missing out because you're seeing your friends out having the life you wish you were having and not realizing they're not actually experiencing what you think they're experiencing. They may be struggling as well. So there is a false pretense that can come out of that, and educating that's a truth can help.
Yeah.
Yeah. There's somebody said nobody posts a bad day on Instagram.
Right.
It's only like the perfect picture. Everybody's smiling. The house looks beautiful. Where you are looks great. Just keep that in mind. Thank you for sharing your personal stories, and thank you for helping all that you do to help our community and additional people. Xiaofeng Chen from the Alan Yu Foundation and Steve Nimmo from the Z Cares Foundation. I appreciate you both being here with me today. Thank you so much.
Thank you, Gary.
Keeping track of 3 counties, 40 cities, and 55 school boards across Contra Costa, Solano, and Alameda counties is a lot. Good news, Locunity is launching in your community next week. We transcribe and analyze every meeting and give you a heads up when something crucial is on the agenda. Sign up for exclusive newsletters, podcasts, and community outreach tools at locunity.com. That's LOCUNITY.com to join today, or request a custom plan for your organization.
Wait, don't leave yet. Hit subscribe. Make sure you get the weekly updates. We have a new episode every Wednesday for stuff happening in the East Bay. In the meantime, follow me on LinkedIn, Jared Ash, or check out our firm where we have a weekly newsletter and blog at Capstone Government Affairs on LinkedIn. Thanks for joining us today on the Capstone Conversation.